At the end of the webinar, which will last about a half an hour, as I said, you'll be able to ask questions you may have. Please use the question box in the webinar toolbar on your screen on the right. We are fortunate for our healthcare reform webinar today to be able to welcome our webinar leader, Mr. Eric Gasho. Eric Gasho is the Director of Government Affairs at the National Health Council. The NHC is a Washington-based nonprofit, the only organization that brings together all segments of the healthcare community to provide a united voice for more than 133 million people with chronic diseases and disabilities and their family caregivers. Its core membership includes the nation's leading patient advocacy groups. Other members include professional and membership associations, nonprofit organizations with an interest in health, major pharmaceutical, medical device, and biotechnology companies. Prior to joining the National Health Council in 2009, Eric Gasho worked in the Government Relations Department of the Society of Teachers of Family Medicine. He earned a BA degree in both government and business management from the University of Redlands in California, 2 BA degrees. We're very fortunate to have Eric as our webinar leader today, and we're grateful to him for sharing his time and his expertise. And I'll turn it now over to Eric Gasho.
Great, thank you. If I can have my slides be shared. Great. So I assume you can see my slides now. Thank you so much for that introduction, and thank you for having me here today. You did a very good job there kind of explaining who we are at the National Health Council, so I can actually probably skip over these next 2 slides. I'll just say very quickly that our mission is to provide a united voice for people with chronic diseases and disabilities and their family caregivers. And on this slide, you can see a sampling of the patient organizations that we have in membership that really run the gamut of the entire patient community.
Can I stop you for a second, Eric? Terrell, I
Yeah.
just want to ask, I can't see Eric's screen. It may just be me, but I just want to make sure everybody can see it.
I think his screen should be shared. I'll Eric, are you
now?
There we go. Okay.
All right.
Here we go.
The button. All right. There you go. So here is our mission, and here is a quick shot of all of the members that we have in our membership. So what I'm going to talk to you today a little bit about is the Affordable Care Act. I'm going to take a very careful and balanced approach to the bill because as it is, obviously it's a very politically charged piece of legislation, but at this point it is the law of the land. So in our view, the important thing is to really be focused on what patients need to know about how to best get coverage. So I'm going to talk a little bit about some of the patient protections that are included in the bill, talk about some of the challenges that we're still seeing, and then I'm going to talk about some really exciting new tools that we're putting together at the National Health Council, and actually the people on this webinar are going to be some of the first patient representatives to really hear about what we're doing. It's really exciting. So open enrollment is going on right now. You have until December 28th to purchase the insurance that will start on January 1st, and then you have until the end of open enrollment, which is March 31st, to actually get coverage to avoid the individual mandate. So as I mentioned, I want to talk a little bit about some of the patient protections in here that are why we at the National Health Council and a broad swath of the patient community is really excited about this law fully taking effect. There are a lot of really important provisions that we have to really make sure that we remember that we fought for in the passage of the law and are really happy to see come into place. It really is a game changer for people with chronic diseases and disabilities. This right here shows 4 of the most important ones. Pre-existing condition exclusions. This is something that is just hugely important. If anyone has not been able to buy insurance or has been kicked off of their insurance plan because of a diagnosis, insurance companies are no longer allowed to do that, and that's really exciting. There's new rating rules, so people cannot be charged more for their premium because they have a pre-existing condition. There are only things that people can now pay a higher fee for are there's age rating band, there is a higher rate for people who smoke, and there's some give depending on your region. So there's nothing that will allow companies now to discriminate against people with pre-existing conditions based on coverage and their premium. Another thing that we fought really hard to have into the law is the essential health benefits package, and I'll get to that in just a second. But essentially, it's a package of benefits that every insurance company now must cover. The final one is limits on out-of-pocket spending. So when we talk about out-of-pocket spending, we're talking about all of the dollars that one would pay throughout the course of a year for their health care that's not included in the premium. So it could be their co-pays for doctor visits or for drugs, a deductible, co-insurance, all of these things that are still costing you money to your insurance provider other than your premium. Now companies are forced to put an overall cap on how much of that money you can pay. So I'll talk about the last two here a little bit. This slide talks about the minimum essential health benefits. This was included in the law. There are 10 categories that all plans must now cover. These are a lot of things that a lot of plans did cover, but a lot of them didn't before. So we're really excited about this. Essentially, the law stated that a plan has to resemble a typical employer plan. Oftentimes in the individual market, we would see plans that were not as robust as employer plans. And one thing that the law does is really sort of levels the playing field and creates parity between the two markets a lot more than we saw before. So these are the 10 that must be included, and in a lot of cases you saw a lot of other plans adding other services that were based on a typical employer plan as well. And these will all depend on the state that you live in. As I mentioned too, there are now limits on how much insurance companies can charge. So there are limits on your out-of-pocket costs, as I mentioned. For 2014, it will be $6,300 for individuals, $12,700 for families. So this is still a lot of money for a lot of people, but it really is a lot easier than we had before, where oftentimes if someone had high medical expenses would be forced to go into bankruptcy. So there really is a parachute protection in there for a lot of people. The other thing that's really important to realize too is that there will now be financial support. So for people who are at 400% of the federal poverty level, which equates to, for a family of 4, about $94,000 of annual income for the family, you would be eligible for a tax deduction for buying insurance that'll subtract money from your premium. So when you talk about $94,000 for a family of 4, that means a lot of people are going to be eligible for these premium support subsidies, and this is something that we're really excited about. The other thing is that for a lower income threshold, there is now assistance for people if you buy a silver plan, and I'll explain in a second what that means. You will be able to be eligible for assistance paying for all of your out-of-pocket costs, such as co-pays and deductibles. And when you go onto the insurance exchanges, which I'll also talk about in a second, you should be able to, it'll tell you whether or not you're eligible for these different subsidies. So I talked a little bit about the metal levels, and I think some people are hearing about this but don't quite understand what it means. So in the law, plans are required to offer different levels of benefits. So you have a bronze plan, silver plan, a gold plan in all states, and in some states you'll have a platinum plan as well. And a lot of people, I think, instinctively when they hear this, they think that means, oh, a platinum plan is going to cover more drugs, it's going to have more doctors and network, it's going to generally be a better plan. That's not necessarily the case. They'll typically cover the same benefits, but it's the amount of cost sharing that one must incur that will change with them. So you see here a platinum plan will cover 90% of your expenses, whereas bronze plan will only cover 60% of your expenses, and the rest is must be paid by the individual. So what you'd kind of look at here, and I'll show you more in real numbers, and these are just sort of based on a real plan, but they're more intended to be illustrative more than they are to show you what an actual plan is. If you look here, this shows you that while the platinum plans will have higher premiums, you're typically going to have a lower out-of-pocket maximum. So for someone who intends to have a very high cost of services over the course of the year and typically hit that the congressionally required out-of-pocket maximum, it might make a lot of sense for you to buy a platinum plan. While your premium is going to be a lot more, the out-of-pocket maximums are typically going to be lower, and that's only for the platinum plan, if you notice that here. So other than that, it's going to depend on the person. It's going to be important to really do your due diligence when shopping. A bronze plan might make sense in the states that don't have platinum plans because that out-of-pocket maximum that the federal government will be imposing will be really helpful for you. I'm sure a lot of what I just said probably was incredibly confusing, as it is to a lot of people. So the important thing to realize is that help is available. When you go onto the marketplace websites to look for your insurance, you will have access to 3 different levels of people to help you. You'll have navigators. In some states, you'll have in-person assisters, and in all states, you'll have the certified application counselor. So these are people who are trained to help you navigate this new terrain that a lot of people just don't have any familiarity with of purchasing insurance. This slide here shows the difference between the 3. Very text-heavy. Don't expect anyone to read it right now. But I wanted to show this one as an example of the materials that we have available at the National Health Council's website. We spent a lot of time and a lot of effort putting together materials for our members and the patients that they represent to be able to understand what the Affordable Care Act really means to them. So you can see here that if you just go onto our homepage at nationalhealthcouncil.org, at the very top here where these arrows are, you click there, and there will be a website that has a whole host of different materials that are really intended to be able to help you understand how the marketplaces work. We have overviews of the new insurance paradigm. We have that sheet that I just showed you that talks about the different people who can help you find insurance. We talk about some of the financial protections and cost-sharing subsidies. And we even have a checklist that will tell you what you should know, the information you need to bring with you when you actually go onto the website to look for health insurance. There's a lot of stuff on it people don't realize that they're going to need to know. It's good to have that all with you when you go log on. So, as I said, there's a lot of really good stuff on our website, but that is just the tip of the iceberg of what we're producing. So what we're putting together is a new website called puttingpatientsfirst.net. And as I mentioned, this is something that you guys are hearing about before almost anybody else is. This will be launching probably next week. We'll be sure that the folks at HAEA send out information on it when we do launch it so that people can log on. This will do a lot of really cool things, a lot of really important aspects of healthcare reform will be covered through this. And we're launching it in a few different phases. And the first one is what we call Answer My Questions. And so this is where we'll move a lot of those resources that I talked about that really explain what the marketplaces are, what patient protections are included in the Affordable Care Act, really just what it means for you. As I mentioned before, the ones that are currently on our website are more for our members. This website is more going to be for people like you who don't deal with a lot of this stuff on a daily basis. So it really is supposed to be intended for the end user of healthcare, which is the patient. Also in phase 1 is a really cool feature called Share My Story. This is where we can really use your help. We are looking for patients to log on and tell us what it's like shopping for health insurance on the marketplace. I'm sure if people were going to do this last week or last couple of weeks, it would be, the website doesn't work. It's obviously important to know. But this will be even go more in depth and then go all the way until the end of next year, where once people do have their insurance, they can say, oh, I really had a hard time accessing my provider. I didn't have access to the medications I needed. These types of things to really know what the problems are that they're seeing, so that when we go and talk to the people in the administration who are going to be making modifications for next year, they really are hearing from the patients to know where there are concerns. And I think that that's going to be really the best way for us to be able to advocate for change on behalf of you all. The second phase is also going to be very important, and this is to actually help you find the plan that's right for you. As I mentioned before, people are going to be buying insurance right now, and a lot of the tools to help them find the right plans really aren't going to be out there, and we're trying to help fill that void. As I just talked earlier about the different metal level plans, just finding that is just one small step in it. You also are going to be able to tell whether or not a particular plan is going to cover the drugs that you take. You need to be able to tell if the providers that you're currently seeing, or even at least specialists that you need to see, are going to be in the network of the insurance plan. A lot of this information is available, but really hard to sift through. And so what we're intending to do is create a sort of calculator that will help you determine, based on your actual healthcare needs. You can put the information in, down the level of detail of, I take this medication, I refill it this many times a year, I see this many specialists, I see a primary care physician this many times. Really the things that drive your costs, and it will tell you how, depending on which plan you pick, how your out-of-pocket spending is going to be driven by that. And so while it won't tell you the exact plan that you should be picking, it will sort of help narrow down the field of it, because in some states we're talking about hundreds and hundreds of potential insurance plans to choose from. How do you find the right one for you? And so we're really intending to help make that decision a little bit easier. For people who don't want to put all their information in to go through that process, we're also offering a sort of choose-your-own-adventure type of deal, where we'll have 5 different real people, real patients, who have very different healthcare needs, and you'll be able to say, okay, this one is most like me. These are the type of healthcare needs that I need, and then it will kind of tell you what plans would make sense for that person, and how their different utilization of healthcare services will drive their costs. So as I mentioned, that will be phase 2, which won't be available until January. But once we do launch the website, we'll have this right on the front page that will let you put in your email address. So we'll be able to keep everyone up to date on how we're coming along with the website, and be able to tell you when things launch. So as I mentioned, we're really excited about some of these tools. We really want to see this thing work right. There's a lot of patient protections out there, but there's also a lot of questions that people still have, and very rightfully so. So we'll continue to work with the various patient advocacy organizations and the administration to make sure that we really do get this right. And with that, I'm happy to take any questions.
Hi, Eric. I have a couple questions that have come from folks on the line. And so I'll start with the first question that we got, which is, what happens in states like New Jersey, which doesn't have competitive exchanges?
So, and one slide that I typically include in this and didn't is a map of sort of how the different states have fallen. So about half the states, actually no, it's about less than half the states actually chose to do their own state-based exchange. For states like New Jersey, they'll be doing what's called a federally facilitated exchange, where it'll still be a competitive exchange where insurance plans are competing and just plans in New Jersey, but it'll actually be run by the federal government. And so in a lot of cases, this can be good, because I think that there is a lot that has been learned as the administration has gone through the process of this. And a lot of this, there will be some consistency within the states. But on the other side of it, a lot of the states, such as California or Maryland, which really were at the forefront of creating their own exchange. I think we're seeing a lot of new patient protections there as well. So you'll buy the insurance just the same way you would. You go on healthcare.gov, and if it's an exchange that is state-based, it'll direct you to that one. And if it's through the federal government, you'll go through the healthcare.gov website.
Okay.
Eric, you wanted to maybe give the screen back to Terrell and
Oh, yeah, sure. Let's throw this one out.
great, thank you. And Terrell, go ahead with the next question.
Yeah, just 1 second. Yeah, so the next question that we have for you is there going to be a resource linked to the premium subsidies? Are they already designated? Are there already designated organizations that will provide premium support? I think that's more kind of an HAE question for maybe Jan and Pam, unless Eric, you want to take that?
Well, I'd say the premium support, too, will be done through the federal government as well. So that's something that when you go to shop for your insurance, it has you put in your expected income for the year. And then that'll tell you what you're eligible for in terms of premium support. And so that'll be at the end of the year when you file your taxes, they'll verify that's what it was, and it'll just come out of how much you're paying for a premium every year. But I don't know, there'll surely be other areas of assistance as well if anyone wants to fill in.
So from the HAEA side, I will just say we won't be providing direct assistance, but we will certainly, through our patient services, be able to guide people through this process and help them to find the resources, such as the ones that Eric is talking about. And we'll help patients then find those resources.
Well, can I actually make one point that I forgot to, and this is a question that usually comes up when we do these type of presentations. I know a lot of times we'll hear the question, how is my insurance going to change if I'm on Medicare, and how is it going to change if I'm in a employer-sponsored coverage? And I just want to comment on the fact that when we talk about having to go out and buy insurance on the exchanges and on the marketplaces, this is only for people who will be buying individual health care plans. So if someone is on Medicare, nothing will change in how you're going to obtain your insurance. If you have a employer-sponsored coverage, they will be buying your coverage in the same way they do now, and you won't need to do anything. So I think a lot of people get a little nervous when they hear about what they need to do before January 1st. But if you're on Medicare or have employer-sponsored coverage, nothing will, in that regard, will change for you.
Another one of the questions that we have is, does age impact premium costs for patients?
Yes, it does. As I mentioned, there are only 3 things that will impact your premium. One is your age, and that's a very gradual number that they use to multiply to figure out how much it is, starting at, I think, age 27. So it's, it is a consistent increase, but a slight increase. That's one. The other is whether or not you're a smoker. Smokers can be charged more for their premiums. And there's some flexibility for insurers depending on regional differences as well.
Okay. One other question that we've received is there a place where folks will be able to get a side-by-side comparison of cost for the metal tiers?
It depends on the state you're in. Some of them are doing better with their comparison tools than others are. As I mentioned, what we're putting together when it launches in January, it'll show you not just with your premium what the side-by-side will be, but it'll show how your selection of the metal level will really drive your out-of-pocket spending as well. So while there will be a calculator on the marketplace website, that's just going to encourage people to shop based on their premium, which for someone who's young and healthy and doesn't plan on using their insurance all that much is probably fine. They can get the cheapest plan out there. But for someone who has anticipated needs, they really do need to make sure that they're paying attention to a lot of the cost-sharing mechanisms that are included as well. and we'll be helping people determine that.
And this might be a broader question as well, but one of the questions we received was, how do I ask if there's insurance coverage for my visits to allergists and to specialists?
You know, and this is really one of the things that has been of biggest concern to us, is that plans are required to disclose the providers that are in their network, and they're required to disclose the drugs that are on their formulary. Problem is, the way that they disclose them is not done in a very user-friendly way, and unfortunately, I think some of that might be intentional. They're only required to have it somewhere on their website, and for someone who needs access to these providers, it's going to be quite difficult. And so, what I would recommend is make sure that you find the helpers that I showed, the navigators, the assisters, the insurance application counselors. Those people should be able to help you navigate some of these complexities.
Okay. And here's another question, Eric. My plan is scheduled to change, but under my existing coverage, I went through a very lengthy approval process, treatment plan approved. Is there a way to get these types of plans pre-approved prior to dropping one plan and starting another plan? And again, that might be a broader question as well to maybe Janet or Pam.
Yeah, and this is something that we've had a lot of concern about as well, and I think we continue to be concerned about it. I think it's going to depend on the state. That's one thing that we certainly have advocated, that as people go from plan to plan, which will happen probably more frequently than it did in the past, that they won't have to go through all those steps again. This is something that we see in a lot of the different patient communities that we represent, where oftentimes if there's, for example, if there's a product that treats your condition in both generic and brand form, they'll start you on the cheaper one and work your way up until you get to the one that works. But for people who've already gone through that process, they know what works for them. And it's something that's really important to us, that people will be able to stay on what they have. It just depends on the state. We don't have a lot of clarity on this. We're still seeking clarity on it, and we'll be sure to let people know as we learn more.
And then one other question that folks might have is, how are the tax deductions for premium assistance working, and what's the process for that?
Yeah, so as I mentioned earlier, as you go to shop for your plan, you'll put in what your estimated income for the year will be, and that will determine right away what your premium will be. So what your premium will be once they actually take off the assistance. So, obviously not everyone's income stays consistent year to year. Hopefully a lot of people will be making more money than they did. Obviously some people might lose their job and be making less money than they do. So at the end of the year, when you actually file your taxes, it will look to see how close you were to estimating it. And if there's some off, you'll either owe money or you'll get a refund.
And I also want to let everyone know that's on the line, this conversation is being recorded. We had a question. And then one other question that we've received is, I have health care through my employer in Ohio. Am I eligible for lower priced health care? Will that be a reality under the healthcare law?
It will not be. When you hear about all of the cost-sharing subsidies and the premium support subsidies, those are for the exchanges. So you might be hearing a lot about employers who are thinking about moving their employees and stop giving them coverage and offering them money to buy on the exchanges. And I think when you hear about some of the companies doing this, a lot of them might be doing it to save money, but there are some out there that I truly think are doing it for because they know it will benefit their employees who will have to end up paying less for it. But yeah, that's one of the things that that we're seeing is there's going to be some discrepancy in whether or not people are on the individual or the employer-based market. But yeah, to answer the question, those will only be available for people who are buying on the exchanges.
Okay, if folks have a couple more questions for Eric, because that concludes the questions that I think that we have. Hopefully I haven't, it's a pretty small chat window that I'm reading through, but I think that it has answered pretty much everyone's questions.
Thank you, Terrell. And thank you, Eric, for providing this incredible information to us all. I think it's important to mention again the nationalhealthcouncil.org website, the puttingpatientsfirst.net, which will be coming in about a week, and of course the haea.org website where you can find your patient services team member and you can talk with them. And in addition is Terrell from the Health and Medicine Council of Washington, the HAEA's lobbying firm mentioned. This is being recorded and will be up on the HAEA website for those who want to listen again or want to let other folks that they know be aware that this will be available later to listen to again. So we thank everybody. Thank you, Eric Gosh, for being our leader today. Thank you, Terrell, for organizing this webinar. Thank you, everyone, for joining us. And we hope if you have further questions, you'll feel free to talk with your patient services team member or log on to the website and shoot us a question. But we really appreciate Eric Gasho from the National Health Council being here today for this first informational webinar. Have a good day, everybody.
And Eric, we did have just one last question. If you wanted to respond to it that way, it's on the recording for everybody. It's a question about California and what are your thoughts on California's state-based health exchange. And I've heard things about it, but I'm sure you've heard other things as well.
Well, that's a great question as a native Californian. Yeah, I think it's going to be really interesting. I talked about the essential health benefits of things that need to be covered, and there's some variance in states. California is one of the strongest. It's always kind of been that way, where they've had a lot more services covered than other states. Where we do have some concern is that their plans, the benefits that are required, are based off of an HMO, which for practical standards means that there might be more limits on the amount of services that people are able to have. Haven't really done too much digging into the plans that are coming out yet, but I do think that California generally seems to be doing a really good job, and obviously understanding that they have one of the higher uninsured populations in the country. It's really important that there's now insurance for all the folks that are there.
Okay, well, thanks so much, and
Terrell,
last question in.
Terrell, this is Pam. Eric, can you hear me?
Yes.
Yeah, I just had one last question. Some of the HAE patients, are on some of these high-cost medications.
Yes.
And I was, listening to what you're saying regarding the premium support, and some of the folks may, as they're applying online, qualify for some premium support subsidy. And so my question is this: if a patient is on a high-cost medication and they might get a premium, subsidy through, the exchange, is that patient also possibly able to qualify for one of the premium support programs that might be offered through the manufacturers of the medications?
And that we do not know about, and that's been one of the biggest frustrations I've had in the last month or so, is we've heard mixed things from the administration from through various ways. We're hopeful that those plans will still be able to exist. As you might know, Medicare Part D, they don't. And there's a federal anti-kickback law that does or does not apply to these, and they still haven't given us clarity. And we recently wrote a letter to the Secretary and to a few other people in administration. I've been talking to folks on the Hill. We're trying to get some clarity on it. We're hoping it's going to go to the way that people will be able to access them, but we'll be sure to keep you posted on that.
Yeah, and again, I just want to extend my thanks for your time today. And we will be getting some probably additional questions, post this webinar. Folks maybe go online and hear it on the website, and we may get some additional questions that come in, and we may follow up with you to get some of those things answered as
Sure.
well.
You know where to find me.
Yeah, we really appreciate all your time and help.
No problem.
Thank you again to Pam King, the HAEA Business Consultant, Terrell Baptiste from the Health and Medicine Council of Washington, Eric Gasho from the National Health Council, and have a great day, everybody.
Great.
Thank you.
Thank you.